Talk about it. Get ready, my friends, for harsher, more stringent lockdowns during the next pandemic. Don't take my word for it. Take the word of the World Health Organization and former UK Health Secretary Matt Hancock, who warned yesterday during testimony that we need to lock down harder next time. We need to lock down harder, his words, when the next severe virus hits us, because that severe next virus is coming. Remember, Bill Gates told us that the next one would be more severe. It's already in the works. Oh, it's coming. So of course it's coming, and they will lock us down harder than ever before, because that, according to these health ministers, was the great mistake, that we didn't lock down hard enough. We were too lenient on people. Yesterday, this pinhead, Matt Hancock, testified before the UK's COVID inquiry to figure out what went wrong and what went right. And newsflash, nothing went right. In fact, it was the worst possible outcome, and Matt Hancock, the health minister at the time, has blood all over his hands. So here's how the Telegraph lays out the sort of web of people involved in there. There's Matt Hancock right in the center of your screen, the who's who of the folks involved in the lockdowns that screwed millions of people out of their jobs and health and future income. And I mean, any other thing you can think of? I mean, mental health disorders increase. I mean, all
manner of now unpredicted deaths. You recall, Matt Hancock is the one who had his his messages leaked from the woman who was writing a book with him. That showed that a lot of the policies they made during the COVID pandemic, they made the policies first and then sort of reached back and said, where's the science for this? What can we promote it with? How do we use this to scare people to implement these rules, showing that they were not doing this based on any kind of science at all, but only as a power grab.
No,
in fact, when asked to when asked to speak for this, James Bethel, the former health minister, said, yeah, we didn't know what we were doing. Just be grateful we didn't kill your pets. Yeah. This is the same Matt Hancock we're talking about.
Yeah, and this is the same guy who, those same text messages, of course, admitted that they wanted to use intimidation tactics.
Yes.
How can we scare people more, is basically what he said. How can we scare people into this? What can we do to really terrify people? Because that's what you want from your health ministers. So he was the central figure in pushing this draconian lockdowns, the most draconian lockdowns imaginable, but it's going to get worse when they will launch more severe lockdowns. When Boris Johnson made this announcement, Matt Hancock was the man behind this announcement. It's very ominous to watch this now. It's like a minute and a half. Watch him announcing the lockdowns for the very first time.
Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer. And so tonight, I want to update you on the latest steps we're taking to fight the disease and what you can do to help. And I want to begin by reminding you why the UK has been taking the approach that we have. Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses. And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. To put it simply, if too many people become seriously unwell at one time, the NHS will be unable to handle it, meaning more people are likely to die, not just from coronavirus, but from other illnesses as well. So it's vital to slow the spread of the disease, because that is the way we reduce the number of people needing hospital treatment at any one time, so we can protect the NHS's ability to cope and save more lives. And that's why we've been asking people to stay at home during this pandemic. And though huge numbers are complying, and I thank you all, the time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home, because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. shopping for basic necessities as infrequently as possible, one form of exercise a day, for example, a run, walk or cycle, alone or with members of your household,
or a shag,
any medical need to provide care
or an
to
office
help
party,
a vulnerable person,
right,
and travelling to and from work, but only where this is absolutely necessary and cannot be done from home.
Yeah.
That's all.
That's all. That's it.
These are
You can't
it.
have cocktail parties from home. You can't. I
have to
mean,
do it
we
at-
tried it
Yeah.
during the pandemic. People tried it, but no, he decided that was absolutely necessary. This is weird to watch now. I feel like I have almost trauma around it.
It is. It's very painful to watch. And I went through a whole bunch of his speeches today, not just that one, but a whole bunch of them in research for today's segment. And, you know, what's amazing about that announcement, we now know, is that Matt Hancock knew at that time that lockdowns would cause more harm than good. So, I mean, it wasn't even close, actually.
Well, the video we showed yesterday showed that the World Health Organization already had poverty statistics about what would happen with lockdowns. They knew how many more, girls would be married off early, how many more child brides, how many more people would be pushed into poverty. So that was presumably information that could have been shared with governments.
So then it was wild yesterday for him to try this sort of half-hearted apology, because he knew ahead of time. It's like premeditated murder. Like, he knew ahead of time how much this would screw up society and then did it anyway. So yesterday he came up with this half-hearted apology during this inquiry, and he turned to the families of those who were there to look him down and stare him down, who were had lost loved ones, who were there to confront him. So he turned to them to give this sort of half-hearted apologies. These families turned away from him, didn't even want to look him in the eye. Here was this half-hearted, weird apology yesterday from Matt Hancock.
And if I may say so, I am profoundly sorry for the impact that had. I'm profoundly sorry for each death that has occurred. And I also understand why, for some, it will be hard to take that apology from me. I understand that.
Oh, yeah.
I get it.
Do you?
But it is honest and heartfelt, and I'm not very good at talking about my emotions and how I feel, but that
You can
is
text them, though.
Yeah.
honest and true, and all I can do is ensure that this inquiry gets to the bottom of it, and that for the future we learn the right lessons so that we stop a pandemic in its tracks much, much earlier, and that we have the systems in place ready to do that, because I'm worried that they're being dismantled as we speak.
Oh, yeah. They're being taken apart.
And what did we do to stop that pandemic ultimately? Oh, yeah, we lifted restrictions and
Right.
let it play its course.
Right. And so now what you see in the UK, of course, is an explosion. And they had the data. What they saw in response to the lockdowns, just one anecdote, is an explosion of RSV cases. Why? Because, as they had later admitted, well, it didn't have its natural course to run through the population. Kids to be able to deal with it, families to be able to deal with it. No, you kept people away from one another so that when we reintroduced everyone, boom, you see this massive cancer bomb. You see an RSV explosion. All of these people who couldn't get access to cancer care at the time. Cancer bomb, as they're calling it. So he was pressed on lockdowns yesterday, and he doubled down. He thought he would say, well, we learned our lesson. No, in fact, he doubled down, saying we should have locked down earlier and harder. He said this without an ounce of evidence to support it, by the way. In fact, the evidence goes in the opposite direction, from soaring child mental health referrals to the cancer bomb of patients whose treatment was delayed alongside the struggling economy. So these people couldn't get cancer treatments because it wasn't deemed necessary to go and get a cancer screening or a cancer checkup. No, it's not necessary. So you got to stay home. And it turns out that the UK health ministers, including Hancock, knew this. The lockdown files report from The Telegraph, by the way, the only major media organization covering this story. So bravo to The Telegraph for actually doing the lockdown files. I don't agree with some of their other reporting, but bravo job on this. Revealed stunning details a few months ago in the lockdown files. Here's their cover story of the lockdown files. I encourage all of you to read it, where they have those 100,000 WhatsApp messages between Matt Hancock and the other ministers and officials at the height of the pandemic, looking through 2.3 million words and conversations about school closures, testing, face masks, all manner of it. And we now know that the ministers were warned that lockdowns were worse than COVID itself. They knew this. Here's the Telegraph headline: How ministers were warned lockdowns could be worse than COVID itself. Leaked messages reveal how leaders grappled with the impact of national shutdowns while trying to contain the virus. As the Telegraph reported, messages revealed they were fully aware of the devastating effects of the lockdowns. Quote, the ministers and officials behind lockdowns were well aware of the possibility and the reality of collateral damage being caused to millions of lives as they pushed ahead with the controversial policy, despite warnings that the cure would be worse than the disease.